everyone. Welcome to my YouTube channel. My name is Alona. I am a retired public health nurse and a breastfeeding and lactation consultant. So today I've chosen a really interesting topic for my viewers, especially this time of pandemic that it's so hard for mothers to ask for breastfeeding support or to see a lactation consultant if they have any breastfeeding issues. So I'm live today. This is my first time doing live, and I want to reach out to those mothers. If you have friends who have little babies or little children, and who are those moms who are suffering or experiencing breastfeeding problems, this is it. I'm here to give you evidence-based information, and I'm here to help you. If you have any questions, any problem about breastfeeding, I'm here to answer your question based on research information. So I want to discuss briefly on what is the really number one problem in breastfeeding for so many moms out there, especially based on my experience in our breastfeeding clinic. One of the most common problems that moms begging us, me as a lactation consultant for help, is having a sore nipple, a painful sore nipple. And this happens to most of the first-time moms out there who don't have any good experience or good knowledge about proper latch and proper breastfeeding. So the one of the reasons why most mothers is experiencing sore nipples is, number one, it started with a bad latch. It's starting with a poor latch. Now, it depends on the size of the baby. It depends on the baby's medical condition. If the baby is preterm, obviously, most mothers with preterm babies would really struggle with proper latch, because just to open that tiny little baby's mouth. So I have a baby here. So if this is a preterm, the baby's lips or the mouth, just the lips around the lips of the baby's lips are not fully really well developed. They're so thin, they're so tiny that they're not really strong enough to hang on to the nipple when you're latching it. So if your baby is preterm right now and you're struggling to latch because, number one, there's so many moms out there who have very large nipple, and when they have preterm babies with a tiny little mouth and thin lips, that baby would really struggle to maintain good suctioning. So that's one of the reasons that why some mothers' nipples get sore, because again, when the baby's latching and cannot hang on to the nipple because of the weak muscle tone, it keeps sliding out, and it makes the latch really shallow. So if the latch is very shallow, instead of latching right to the areola here, but the baby's mouth or lips is just hanging onto the tip of the nipple. So that's one of the reasons why the nipple gets really sore. And to be honest, for first-time mothers, normally your nipple gets really sensitive during the first 3 or 4 days after birth. That's normal. Because again, if you're first time, you never breastfeed before, so it's a little bit tender. However, the tenderness and the kind of discomfort thing will go away during the first week until you really establish a perfect latch. Now, what are the things that you need to do if your nipple continues to get really sore? Number one, do not breastfeed in that very, very sore nipple. Do not continue breastfeeding in that very sore nipple if it's really painful. Okay, give it a break. You can do maybe skip two latching. Maybe if you latch this morning and you feel like your nipple is really, really sore, do it maybe during the afternoon. But do not abandon your breast, because if you're not stimulating the breast because your nipple is so sore, then your breast milk will decrease because you're not stimulating the breast. You can manually express it and give that milk to the baby, or you can pump it depending on how sore you are. Now, best cure for sore nipple is you can put cream around it. Either you can use some of my patients in our breastfeeding clinic, they use Vaseline cream or they use olive oil around the nipple. Make sure you have no allergies to olive oil or even coconut oil around it. Some moms would use their own milk to rub around their nipple. Other moms would put cold compress. And what's that? You can use a cold towel, put it in your breast, or you can buy a breast pad. If you're breastfed right now, put a little bit of water in it. You can put it in the fridge, chill it, let it cool, and then put it in your nipple. That will really soothe your nipple if it's really painful. So again, the nipple soreness should not last for a long time if you fix the latch. Now, there are times that even the mom keep adjusting the latch, repositioning the baby to different sides, but still their nipple is still sore. There are some moms who have a really sensitive nipple, and it is because of the changes of our hormone. So if I were you, if you're the type of person whose nipple soreness will go away for a while, so making sure that do not latch the baby very shallow, because again, when the latch is shallow, the baby's mouth tends to be right on your nipple, not in your areola. So it makes it worse. So making sure you protect your nipple, making sure you wash your breast, you wash your nipple every after feeding to prevent infection. Because again, breast infection or nipple infection is painful. I've seen it many times in our breastfeeding clinic that so many moms are struggling. So one thing that I want to stress out with a poor latch is it's how you position your baby. So let's say you have a small baby, but you have a big breast. So most mistakes moms would do is, even if they have a small baby and they have a big breast, they use a big huge pillow. So here's the thing: when you have a big breast and you have a big pillow, so your baby gonna be right on top of your breast because of your big pillow. If I were you, put the baby first to the level where you're most comfortable is. So put the baby where I don't know, I'm gonna say like this, okay? So the level of your baby's nose should be the level of your nipple. So if you have a big pillow right now below your baby or on your lap, so the baby gonna be higher than your nipple because you have a big breast. So making sure the pillow should support your arm and not the baby, because if when you do that, your baby gonna be too high, and the level of your baby's mouth and the level of your nipple gonna be off because your baby gonna be too high, your nipple is down there. So making sure choose the right position depending the size of your breast, depending on the size of your baby, and depending on the position that you're comfortable with. Now, for moms who have big breasts and you have a small baby, what's the best position for you is you can do a football hold. You can do this football. This is a football hold. And if you can see, when I hold my baby in a football position, your baby's chest is not squeezed in with your big breast. You know what I mean? Because some moms, most problem when they have big breast, their breast is hanging onto the baby's chest over here. However, when you do a football position, your baby's mouth is just gonna be right to the side, but yet you can guide your breast using a C hold. So if this is, I'm just gonna use my thing. So this is a C hold. So if the baby is there, so you can just guide the baby into that side, or you guide the baby to that side, depending on how you want to hold your breast, okay? I always do the C hold and flip it. Flip meaning I hold it C and I flip the nipple up. The reason why I'm flipping the nipple up, so that the nipple is pointing to the roof of the baby's mouth, not in the middle, this way. Because if the nipple is right in the middle, your nipple gonna be sore. But if the nipple is pointing to the roof, so your nipple is untouched. So that's how I use it. So when I hold it, and I flip it. Now, it's easy to see. It's easy to see it when I'm doing it because I'm using a really soft breast model. However, what if your breast is so full? Do you think it's easy for you to flip it like that? No, because when your nipple is, when your breast is so full, it's so hard for you to hold its C-shaped hold. So making sure before you breastfeed, you try to massage your breast. Massage it first so that your breast a little bit softer. By the time you latch your baby gonna be comfortably latched properly, and the latch gonna be deep. Because again, if your breast is very, very full and hard, your baby will not be able to fully latch deeply because the mouth will just slide away. These are babies who have a very weak muscle tone, babies who are small babies, or babies who have just a tiny little mouth that cannot open wide to grab the whole part of your areola. So those are the things that you need to do to prevent sore nipples, because sore nipples, there are many moms, based on my nursing experience or our breastfeeding clinic as a lactation consultant, there are many moms who quit breastfeeding because they cannot take the pain anymore. They just want to give up. They can handle the pain anymore, and nobody taught them the right way on how to hold the baby, how to latch the baby, how to position the baby, and what to look for when you're latching. So I've seen this in our breastfeeding clinic, and I'm happy to share or help you solve the problem. So please don't forget to subscribe my videos and put your comments down there. I'll be willing to answer your questions and help you as much as I can, especially this time of pandemic. Thank you for watching me today, and have a really nice day. Bye for now, and God bless you all.